The DML 2000 machine is based on the hybrid capture technology from Kaiyare. So what is the hybrid capture technology? Hybrid capture technology is a technology invented to detect and diagnose the HPV, which is the human papillomavirus, the causative agent of cervical cancer. So what we have now available, the old method of cervical cancer screening, which is visual inspection using acetic acid, and we have the cytology method, which is taking some cells from the cervix and look at them on the microscope. So the VFLI is basically we open the cervix and we apply acetic acid on the cervix. Then we wait for a few minutes. Then the abnormal cells will absorb these chemicals. Then you can see it with your naked eye that there are some changes on the cervix. So this one, it is not very high specific results because most degenerative changes on the cervix and most inflammatory changes, they still take up the solution. So you cannot tell whether these changes are they malignant changes, which are cancers, or just inflammation. So it is not very specific. The other one also is the cytology, which is the pap smear. The pap smear is also, you open the cervix and you scrub cells. You scrub some materials from the cervix. Then you put them on the microscope. You look at the changes happening on the cells. This procedure also still not very. The sensitivity of it is not very high because it depends on the naked eye of the one who examines it. Those two methods, they basically subjective interpretation based on the one who examines them. Although there are criteria for detecting which is normal, which is abnormal, but there is lots of gray zone in between, which is not very clear. But for this new technology, what we're using here, it is the new technology to detect the virus, or the absence or the presence of the virus in the sample. Why do we want to have such technology here? Everyone can get access to this technology to implement it to improve the cervical cancer screening methods. Because number one, having this technology here in Kenya, it can be cost effective. This technology is being used in other developed countries, and it was effective and very successful in minimizing so much the cervical cancer incidences, by scaling it up at a national level using maybe insurance, health insurance. So our goal is we want to reach out to every woman in the country that she can have access to this technology, maybe even free of charge through the health insurance. We need to reach to the regular common Mwananchi deep down in the village who doesn't know even what is cervical cancer.
Hybrid capture test for HPV is currently in the country, and this is the time any lady can walk to the clinician or to the hospital and ask for the test and specify directly that I need a HPV DNA testing. So as soon as the samples get to the laboratory, you are able to do more than, at every run you are able to do more than 80 samples per every run. That within 4 hours you are able to get 80 tests ready. It doesn't stop there. If there were more samples than that, you still can continue working on them, and an average of over 200 samples can be done in every day.